Hello, this is Dr. Charles Krieger, and I want to thank you for visiting the Krieger Health Solutions website. Over the last few decades, we've seen an alarming rise in the diagnosis of children with something called ADHD, or Attention Deficit Hyperactivity Disorder. This may also simply be called ADD, or Attention Deficit Disorder. Of the 10 behaviors you see listed, only 6 need to be observed by a medical doctor in order to diagnose a child as having ADHD. The original pediatric recommendation for that diagnosis was to observe the child for days or weeks before coming up with this diagnosis. Unfortunately, the typical observation time is 10 to 20 minutes before a child is diagnosed and labeled as requiring psychological drugs. When it is determined that these normal childhood behavior patterns have become unmanageable, a recommendation is made to have the child evaluated for the diagnosis of ADHD. This diagnosis is made simply through observation. There are no blood tests, no X-ray findings or MRI results, no lab test of any kind to substantiate the diagnosis of ADHD. Usual ADHD treatment is putting the child on an amphetamine drug, the most common of which are Adderall and Ritalin. The DEA puts these drugs in the same classification as heroin, cocaine, and meth. They suppress the child's behavior. Where the child was once boisterous and talkative, he is now withdrawn and non-participatory. Children often report feeling as if they're being held down or underwater. And once the drug wears off, there's a rebound effect, and the child's hyperactive behavior exceeds what it was before the medication was administered. Worst of all is that there is little, if any, evidence that children using ADHD medication show any significant scholastic improvement. Using ADHD drugs often leads to the use of antidepressants, and the side effects of antidepressants in children and adolescents can be devastating, with suicide, self-mutilation, and sociopathic rage being the result. In addition to this is the psychological scar a child receives from the major authority figures in his life, his parents, teachers, and doctors, telling him that he cannot be normal, that he will not be accepted by society unless he takes drugs. So what can be done? Fortunately, a whole lot can be done. A child who is, to use a common phrase, bouncing off the walls, is exhibiting obvious signs of poor function. In our office, we look for the reasons the child is showing signs of ADHD. We don't treat the symptoms or the diagnosis itself. We look for what might be causing these behavioral dysfunctions. The most common findings we see are nerve irritation caused by misaligned spinal bones, also called subluxations, resulting in hyperactivity of the central nervous system. Biochemical dysfunction resulting from exposure to environmental toxins. And food sensitivities that have previously gone undetected. Chiropractic adjustments and functional nutrition, unlike harsh drugs, are safe and without dangerous side effects. With rare exceptions, children are born to be healthy, and when given the chance, their growing bodies will express optimal health and well-being. Remember, if you do the same old thing, the same old way, you're going to get the same old results. And the fact that you're visiting this site shows that you're tired of those old results. Give us a call. We'd love to help.